Hello, my name is Grace. I'm your nurse today, and I'll be doing assessment from head to toe assessment. Can you tell me name and date of birth?
My name is Seth Joyner. Birth date is 4/2/83.
All right. Can you tell me where you are?
I'm in your father's house.
Okay. All right. What year? What month are we in?
It's 8/20/25.
Okay. So I'm gonna start with your head and your face first to make sure everything's symmetrical and make sure that all the characteristic is intact. Okay.
All
So
right.
I'm gonna go on and check on your forehead, check your hair.
Okay.
Make sure there's no lumps. I do feel little lumps back
Okay,
here. We'll
moving
follow
on.
up with that one. Making sure your eyes and your ears are intact and checking for your configuration of your skulls. And I'm also palpitating your for texture, for the distribution, and also for the facial bones to make sure.
Okay.
All right. Can you open your mouth for me? All right, so everything's intact, your teeth's intact. I'm gonna check for your pupils as well, see if there's a reaction to the light. So look at me.
Okay.
All right, and they are equally reactive to light. I'm also gonna check your nose as well, and everything's nice and moist and pink. All right, now I'm gonna also check for your eyes are good. Let me see. And I'm also gonna check for your, let me just write things, some of these down for you. Everything's intact. And do me a favor, and I want you to read this off for me. Make sure, this is what's called, Rosenbaum chart, and I'm gonna make sure you can read this. Just read a couple of sentences for me.
Or just anything?
Yes.
Hi everyone. We are so excited to kick off our Water Day Fridays tomorrow.
Okay.
I wanted to send out some information. Everyone is excited.
That's good. Okay, so there's no
It's a
problem.
Dave's
We're
email.
checking for your cranial nerve, the second part of that. All right, so I'm also gonna check for your ears, make sure your ear's good, there's no earwax built up. All right, and I'm also gonna check for your palpitator auricles, make sure you are good. All right, and as far as the nose wise, your septum is good. Blow it out for me. All right, how about this one?
Okay.
Thank you so much. All right, and we're checking for your olfactory function. Make sure your sense of smell is intact. Okay, now, I'm gonna check for your neck. Make sure that we are gonna check for your neck and your thyroid, inspecting your jugular. Turn your neck for me a little bit on this side as well. And let me see. Go on and shrug your shoulder for me, against my hand. All right. Now, try to turn your head towards my hand. Try to see. There you go. How about this one right here? Thank you so much. All right. Now, I'm going to check for your lymph node, and I am checking for your preocular, as well as far as your post auricular, and I'm checking for your occipital, and I'm also checking for your tonsil submaxillary as well, and the submental, and I'm also checking for your superficial clavicular chain, and also I'm checking for your posterior cervical as well, and for your supraclavicular, and also I'm checking for your infraventricular as well. Okay, now I'm gonna check for your upper extremities and making sure everything's intact.
Okay.
So I want you to grab my hands for me and try to squeeze my hands, checking, making sure they're symmetrical. Squeeze my hand for me, good deal. Now pull me towards you. All right, push me away. pushing it away.
Not a good idea. Okay.
Just gently.
Oh, okay.
All right, thank you so much. Now I'm gonna check for your elbow, making sure you got a good upper strength. So I'm gonna, there you go, thank you so much. And then do the same thing over here. And everything is symmetrical and the muscle mass is intact, all right? Now I'm gonna check for your radial pulse and also radial.
Same.
On each side, they're all the same.
Okay.
And I'm also checking for your carotid artery on each side and never
Oh,
together. All right, thank you so much. Now, we are gonna do, I'm gonna also teach your lung, but before I do, I'm gonna check, make sure they are symmetrical. I'm checking, making sure everything's evened out.
Okay.
Alrighty. Now, I'm gonna also checking for if you're using any accessory muscles or you have any barrel chest, which I don't see at this time. Okay, so I'm gonna check on 5 different areas. The first one is aortic valve. And I'm also gonna move on to your minor valve over here. And I'm gonna check for your earth points, which is down here at the third left intercostal space. And I'm also gonna check for your tricuspid valve. And last, I'm gonna check for mitral valve into your intercostal space. Alrighty. Now, I'm gonna ask you to turn around so I can listen to your back if you can position yourself. Okay, thank you so much. I'm gonna check on the top right up first. Take some slow deep breath in and out. In and out. In and out. In and out. All right, thank you so much. Go on and turn around for me. I'm gonna write some of these down, make my little notes here. All right. Now, I'm gonna check for your chest. Actually, we're gonna skip that part because we already checked that first. I'm gonna check for your abdomen. Before I touch, I'm just gonna look, make sure there's nothing abnormal. And make sure you don't have any bulging or any contouring or the abnormal movement. And when do you have any pain?
No hernias, no problems.
Good deal. So I'm just gonna listen to your bowel sound from your lower, right lower quadrant. And I'm gonna go up to your right upper quadrant.
I just ate a huge Korean meal.
Oh, no wonder you're bubbling. I'm gonna listen to your left upper and last. Listen to your last on to left lower quadrant.
Okay.
Alrighty. And when was the last time you had a bowel movement?
Twice a day, every day.
Alright, so I'm also gonna percuss. Make sure you don't have any pain.
Nope, no problems.
Okay.
Perfect, tip top Magoo.
Deal. Alright, so let me just write some of these down. Make sure there's no abnormal findings. Okay, now let's see. We are gonna, rest of them is we're just gonna check on your extremities.
Okay.
So I'm gonna look at your feet and your legs.
There they are.
Make sure there's no abnormal, there's no rash, there's
They're
no
all perfect.
swollen.
Everything looks great.
Good deal. So I'm gonna feel for the pulses.
Perfect athletic specimen.
Make sure you don't have make sure you have good pulses on the dorsal pedals. And I want to make sure that you don't have any edema, which I'm checking on the shin bone.
Nope.
And I do not see
Nope, I walk 20,000 steps a day, man.
edema. You're very, very healthy, gentlemen. Now, as far as the range of motion, are you able to lift your arms up and down
Yes,
without
ma'am.
any limitation? Okay. How about your legs? Are you able to lift this knee up?
For sure.
Okay, good
Oh, just
deal.
the knee,
Yes,
okay.
just
Yep,
meeting
for sure.
my resistance. Okay.
No problem.
Now, with your feet,
Okay.
can you push down like a gas pedal?
Wrong, wrong, wrong.
Good deal. Now, put your toes up towards you.
All right.
Okay, there's no deficit on both sides. Make sure write this down for you. As far as flexing, bending, you're pretty good. There's no limitation
Yep,
there.
no problems.
All right. So what I want to do also, I want to do a neurological exam,
All right, check my brain.
which means I'm gonna ask you to stand up,
All right, I'm standing.
and I want you to take a 5-step front.
1, 2, 3, 4, 5.
Okay. Are you able to walk on heel to toe?
Absolutely.
Okay.
Heel to toe.
Good deal. Now, can you come back for me? Now, are you able to stand on one foot
For sure.
with eyes closed?
For sure.
Okay, do the same thing on the other side. Alrighty, now have a seat. Now, I'm gonna check, make sure that you don't have any sensory deficit. So I want you to close your eyes for me.
Okay, eyes are closed.
Okay, now, which arm am I touching?
That's my left.
That's left. Is it sharp or dull?
That's something somewhat sharp.
Somewhat sharp, okay. How about where am I touching now? Is it,
You're not
Which arm?
touching my right elbow.
okay, is that sharp or dull?
It's somewhat sharp.
Okay, I'm gonna try again with a different texture. Tell me, is it sharp or dull?
That's very dull.
Okay, how about this one? Is it sharp or
Very,
dull?
very dull.
Dull,
And
okay.
that's my right arm.
Good deal. I'm just gonna make a little note. There's no deficit. Okay, now I want you to do something for me. Where's my pen light?
What's that?
Just to make sure they can see you.
What do you need from me, lady?
Let me see. I wanna check. Make sure that I'm checking for. Oh, I know. Can you look at me
Okay.
and touch my index finger with your index finger? Now
Okay.
touch your nose. Touch your nose.
Okay.
No, go on and touch your
Okay.
nose. Okay. Now go on and touch my finger again and touch your nose.
Okay.
Do the same thing with your left hand. Put your right arm
Alright.
down. Okay. Touch my index finger and
Okay.
touch your nose.
All right.
All right, and then do the same thing here. Touch
Okay.
my finger and touch your nose.
Okay.
Okay, perfect. So everything is intact as far as your neurological on that one. Okay, I want you to do one more thing for me. With your left heel, touch your shins up and down. Okay, I'm checking for ataxia. Okay, same thing. All right, so everything's intact on that one. So negative for ataxia. Just want to make sure that I have covered. I believe I got one more spot for you. We already checked for your plantar reflexes. Okay, I think we are finished with 13 minutes. All right, Mr. Joyner, do you have any questions or concerns after our exams?
Nope, I feel like I had the best treatment possible and I am in the best shape to live my life.
All right.
Thank you.
Thank you so much for your cooperation. I really appreciate
It's
it.
been great. Thank you so much.
Thank you.